Okay, welcome everyone. My name is Dominic De Los Reyes. My pronouns are he, him, and they, them. I am the program coordinator for the Union of Pan-Asian Communities, or UPAC, COVID-19 Communication and Outreach Services program. We have community health workers who are from the Vietnamese community and Filipino community and Karen, Burmese refugee communities here locally in San Diego County. And tonight is a special night with this virtual town hall we're hosting. We have special guests. And they are going to present information to us about the COVID-19 vaccines, because there's a lot of local updates on that. So I'd like to introduce Dr. Mona AuYoung, PhD, MS, MPH. She's the Associate Director of Scripps CTSA Community Engagement, Scripps Whittier Diabetes Institute. I'd also like to introduce Keni Lasitani. He's the Community Outreach Coordinator at the UC San Diego AntiViral Research Center, as well as Tana Lepule. He's an independent consultant and NHPI, or Native Hawaiian Pacific Islander researcher and advocate. So thank you so much to the three of you for joining us. Also just want to do a little housekeeping. We have a couple wonderful American Sign Language interpreters with us tonight. So every 15 minutes or so, we will take a short pause so they can switch places. So thank you, Lori Bellama and Leah Brown for helping us tonight, as well as Jesse. Um, I'm blanking on your last name, I'm sorry. But for doing closed captioning. And we appreciate that you're helping to make this an accessible event. So if anyone would like language assistance tonight with Vietnamese, Tagalog, or Karen languages, um, our community health workers are available to assist you. So feel free to reach out to them in the chat. You can also type your questions. Hi, Tana. As well as there is a Q&A box that you can type your questions in there as well. And for those of you watching from Facebook, feel free to also type questions in the comments and we can discuss them. So without further ado, I'd like to give the floor to our three wonderful guest speakers.
Thank you so much, Dominic. I'll kick this off by talking to you as we talk to you about the safer holiday season and the COVID-19 vaccines. If the slides will advance, just a second. There we go. So who has been affected by COVID-19? By now we've all heard and we know which communities have been disproportionately affected by the virus. The entire world has been affected, but some communities have been affected a little bit more than others. In one recent study, they looked at 50 million patient records across hospitals across the country, and they found that, no surprise to many, Black African Americans, Hispanic Latinos, Latinx, and Asian Americans were most affected by the COVID-19 virus. So in terms of risk of hospitalization, risk of death, the rates are higher among minority communities. And what's mistaken oftentimes is that this is some kind of genetic issue or that certain populations are just more prone to getting the virus. But what people forget is that a lot of the social conditions that are built in are why these communities are most affected. So in terms of being an essential worker, living with an essential worker, or living in housing that is either crowded or a multi-generational home, puts you at greater risk for exposure to the virus. And often people don't have the same level of healthcare access to get treatment or to get tested in order to try to keep themselves healthy. Further than that, as you saw in the previous slide, that the data was limited to just a few categories. What's important is that we look further into more specific groups of people so we can tailor interventions or provide access to resources that are more tailored to what people actually need. And what I'm sharing with you now are two different studies. So one was done in the Central Valley of California, so where a lot of the agricultural communities are. The farm workers there have the least access to healthcare. They don't have sick leave. A lot of them are very much dependent on these jobs, so they don't really have an option of staying at home. The slogan that everyone keeps saying. So a group out of Berkeley did a study of about 1,000 farm workers in the Salinas Valley, and they found that they tested positive at a rate about 3 times higher than the general population of California during the same time period. And what's worse is that those who were symptomatic and tested positive for COVID-19, a majority of them still went to work because they felt they had no other choice in order to keep food on the table at home and keep some kind of housing for their family. And those who tested positive for COVID-19 were more likely to speak an indigenous language, not Spanish or English. So there are a lot of limitations in terms to what people can or can't access based on their preferred language or whatever language they happen to speak. Um, in San Diego, locally, the San Diego Refugee Communities Coalition put together an incredibly comprehensive report, which is available online. They were able to reach 306 households in San Diego, which represent 18 different countries from Africa, the Middle East, Central and South Asia, and the Caribbean. They used community health workers to help translate, so they were able to administer this in 12 different languages. They found that a significant number have missed health appointments due to fears of the virus or lack of access now that a lot of things have gone virtual. So 30% of households have missed health appointments that were needed. 42% have at least one family member in their household who has lost their job. And almost all, 85% of them that have school age children are lacking support in getting distance learning done. So whether it's not having the equipment or not in terms of not having their own computer or some other way to access the virtual classroom or not having broadband internet, there are a lot of different factors that are coming into play that make it very difficult for everyone to be able to stay at home safely. And as we continue breaking down the data, there is the Native Hawaiian Pacific Islander Data Policy Lab based out of UCLA's Center for Health Policy Research, which revealed that once you break down the category of Asian and Pacific Islander and you disaggregate the data, you can see just how high the rates are. If you follow the orange line across the graphs, you can see how high the rates are compared to all other racial ethnic groups. And even though California is home to the second largest Pacific Islander population outside of Hawaii, there are populations around the country that still need to be served based on the high rates of cases and the lack of services available. Up in the Bay Area, they're also trying to disaggregate the data, even within the Asian category, to further disaggregate to identify which of the communities are impacted and why. So even though the communities speak a wide range of languages, the COVID-19 information available to the community is only available in English, Chinese, Filipino, and Spanish. And one of the patterns that they're seeing in San Francisco, and now this has recently been replicated in New York, the Asian patients have a greater likelihood of dying once they've been infected, once they've been hospitalized. And it's not completely clear why, but there's a belief that racism plays a role, that a lot of these certain communities are placed at the front line of the front line. So in terms of nurses, the Filipino nurses, they make up 4% of the nursing population, yet they're over a third of the overall deaths among nurses. So within the healthcare system, a lot of the minority nurses, like Filipino nurses, are placed in the very front, the most proximal parts of patient care. So they are the ones doing intubations or the ones who are doing the kind of close contact that increase their exposure and risk for COVID-19. And in terms of systemic racism, there's a lot of hate crimes happening since the pandemic began, and some people have labeled it mislabeled the virus, calling it a certain name and inciting hate among others who believe that only certain populations carry the virus or are spreading the virus. And unfortunately, this may be the reason why Asians are being underscreened for the virus and possibly being undertreated once they're hospitalized. And they're not alone. Black Americans are also more likely to report negative experiences since the outbreak. And all of these factors play a role in how people are reacting now that we're at the point where the vaccine is ready. So the vaccine has been prepared in record time, and there are still some who are hesitant to get the vaccine. This is the most recent national poll, and you can see that it's looking up. So fortunately, since September, there is a larger percentage of people who will definitely get the vaccine. But there's a lot more work to be done for people to understand why they should get the vaccine and what they should know about the vaccine, which Keni will talk a little bit more about. Some of the factors are very much related to what people have been discussing up until now. So in terms of masks, do masks protect you from the virus? And is the virus even real? So there are a lot of beliefs and discussions about the COVID-19 overall that impact whether or not people are willing to take the vaccine, and what questions they may have about it. But it's important to hear from people with that background who are working with the vaccine, who have the clinical training, and can really tell you the facts about what the vaccine is all about. So this is a photograph of Dr. Kizzmekia Corbett out of the NIH. So she is the senior scientific lead for coronaviruses. She's been studying this for the past 6 or so years, even before we knew about this pandemic. This is her area of expertise, and she's the reason why the Moderna virus was kicked off to such a rapid start, because her lab was on top of it. They know coronaviruses, and they were able to get things moving very rapidly. So with that, I'd like to turn it over to Keni Lasitani, who can tell you more about his work, both as a clinician in training and in the lab where they're doing the vaccine research.
Great. Thank you so much, Mona, for laying the groundwork for why it's so important that COVID-19 vaccine is being developed. It's still important that we're practicing other preventative measures such as social distancing and wearing masks, particularly as we enter the holiday season. But it seems like the vaccine is probably going to be the biggest hope for us getting out of this pandemic. So with that being said, my hope is not to necessarily convince anyone to enroll in any clinical trials, but my goal is just to provide information for all you listeners so that you feel more informed about the vaccine, the clinical trials, so that you can make a more informed decision about if this is something you want to pursue. I know that there's a sentiment of mistrust shared amongst many communities of color and many minority communities that's rooted in discrimination and racism, not only today but historically, towards clinical trials and hospitals. And so this is a very valid sentiment. And I think that, as communities of color, minority communities, it's important that we ask these companies that are developing these vaccines to be transparent about their safety data, since that is one of the biggest concerns for the general public. So these next couple of slides, I'll kind of discuss how the vaccine was developed, how it works, discuss clinical trials, in addition to addressing some questions regarding the emergency use authorization that Pfizer was just approved for using their vaccine. As many of you probably already know, Operation Warp Speed was started by the Department of Health and Human Services and the Department of Defense with the goal of developing and distributing COVID-19 vaccines in addition to therapeutics and diagnostics, such as tests. And the COVID Prevention Network, which is what I work for as a community outreach coordinator, is a functional unit of Operation Warp Speed. And one of the points that I wanted to highlight was, I know that it's a terrible name for an operation, for the COVID-19 vaccine, particularly when people have concerns about safety. But it doesn't mean that any steps are being skipped. And I'll explain in slides to come that it just means that these steps are accelerated and may be overlapping as well. Next slide, please.
Sorry to interrupt. Can we take
No
a
worries.
breath to switch the ASL interpreters, please?
Of course.
Thanks. Okay, looks like they're all set.
Perfect. Next slide, please. So this is a general overview of the different phases for clinical trials. So phase 1, the main question is whether or not the vaccine is safe. And so a small group of volunteers, anywhere from 20 to 100, are recruited. And basically what is assessed is whether or not there are any severe adverse reactions or events that would that would be a danger to the general public. And so if things go well there, then we move on to phase 2, where the main question is, what is the immune response? So they measure the antibody levels for the vaccines to see whether or not your body is reacting to the vaccine and doing what it needs to do to protect itself from coronavirus. And as you can see, this group of volunteers is a little bit larger, but even during this phase, safety is still being monitored. So they still have a safety protocol that is followed. If there's any adverse events, then the clinical trial is stopped, and an independent safety board reviews the adverse event and ensures that the study vaccine in question is still safe enough to proceed. So after phase 2, we enter phase 3, which is where we are now with all of the clinical trials. And the big questions are, if the vaccine is preventing infections and is it reducing the severity of the COVID-19 infection? And so this group of volunteers is a lot larger. And so I think kind of the main point is safety is being monitored throughout all of the phases. It's not something that is just focused on just in phase 3. So next slide, please. This next slide kind of just gives a general overview of how a vaccine is produced. So the slide before is step number 3 listed here, the clinical trials, which is where we're at. In addition to step 4, more recently with Pfizer getting approved for their emergency use of their study vaccine. But here you can see how long it normally takes for each of these steps. And as you can see, it normally takes years for each of these steps before we move on to the next. But because we are in unprecedented times and this pandemic is affecting many communities, particularly minority communities and communities of color, an unprecedented response is required. And so here in the red, you can see the accelerated process. And so, as I mentioned before, no steps are being skipped. It's just an accelerated process. Some of these steps may overlap. And the goal when starting Operation Warp Speed was to get a vaccine out in 12 to 18 months, which is where we're at now. Next slide, please. So just a brief comment on how the COVID-19 vaccines work. So essentially a vector or a little vehicle is used to introduce the spike protein to your body. And just a reminder, the spike protein is an essential protein on the surface of the COVID-19 virus that is necessary to allow the virus to penetrate your cells and cause an infection and cause disease. So essentially, you can target this protein and we can recognize this protein, then our bodies can defend themselves against the COVID-19 virus. So all of the vaccines are using this spike protein to introduce into your body so that your body can build an immune response to this specific protein. So it's impossible to get COVID-19 from a vaccine. As I mentioned, they're only introducing a small segment of the virus, which is the spike protein. And you need all parts of the virus in order for the virus to replicate. So next slide. So the primary objectives for each of the clinical trials is to, one, ensure that the study vaccine is safe to give to everyone. And the second question is looking at whether or not it's reducing the severity of disease in addition to the frequency of disease. As Dominic mentioned, I work specifically for UCSD, which is an academic research center. And I believe we're closing enrollment for our clinical trials. But there are other private research centers here in San Diego. If you're interested in enrolling in like the AstraZeneca or Johnson & Johnson clinical trials, you can reach out to them. They'll have a clinical research coordinator reach back out to you to go over all the eligibility criteria to ensure that you're safe, you're healthy enough to enroll in the study. Next slide, please. And so I wanted to spend a little bit of time on these points. I know they relate to the emergency use authorization and the limited availability of the vaccines that have been authorized. So the first point being, although Pfizer was able to get an emergency use authorization for their study vaccine, the supply will be very, very, very limited. And so the limited supply will be prioritized for frontline workers, specifically healthcare workers, in addition to long-term care facility residents. And so the EUA will not be available to the general public for many months. So with that being said, it's important that we get these other clinical trials or study vaccines to be approved for emergency use authorizations so that there's an increased supply of vaccines available for the general public. So it's important that, Pfizer, Moderna, Johnson & Johnson, AstraZeneca, if they're all able to get an EUA or an emergency use authorization, then we have 4 different pharmaceutical companies providing the vaccine. So we'll be able to get quicker access to the communities that need it. In addition, if you're currently enrolled in a clinical trial or you're interested in enrolling in a clinical trial, as I mentioned, because a vaccine will not be available to you or unlikely be available to you for several months, enrolling in a clinical trial is something to consider because you have a chance of getting their study vaccine. And as I mentioned, all of these pharmaceutical companies are targeting the same spike protein. So we anticipate that the efficacy of these other study vaccines that have yet to be authorized will have similar efficacy. So another point that I wanted to bring up was if you do participate in these clinical trials and you end up getting the placebo, because it is randomized, what can happen is Pfizer, for example, has stated that those who have enrolled in their clinical trials and received the placebo, they will have access to their study vaccine. And the other pharmaceutical companies are following suit and coming out and making statements about the availability of their study vaccine for the participants in their study who received the placebo. And so the last point that I just wanted to make was that it's important for diverse communities to be involved in these clinical trials because that's the only way that we can ensure that this vaccine is safe for all communities. We cannot generalize efficacy and safety data for all communities unless they're involved. Next slide, please. So I just wanted to make a quick comment about the distribution of the COVID-19 vaccine. As I mentioned, the supply will be very limited, so it's important that we get these vaccines out first to those who are being most affected. Next slide. So this is just a general framework that was produced or made by the National Academy of Medicine, Science and Engineering. which is just their recommendation for how we can distribute the limited supply of vaccines in an equitable manner, ensuring that those communities that are being impacted the most are receiving it first. And I believe that most states and most counties are going to be following this plan. Next slide. So in closing, we wanted to take a pause here and pose this question to our listeners, just to kind of get a general sense of how likely people are to take the COVID-19 vaccine once it becomes available to them. So we will get, there it is. So if you can just we'll give you all a couple of minutes to respond. Awesome. If you think that's enough time, Dominic, we can move on to the next slide. So that's what I had for the COVID-19 vaccine development. We wanted to wrap up by making some comments about how to safely plan for the holiday season. So I'll hand it back off to Mona. Thank you.
Thanks, Keni. And both you and Tana can chime in at any time for this, because these are probably difficult guidelines for people to follow, and it takes a lot of brainstorming to try to come up with some creative solutions. Everyone's talking, everyone enjoys the holidays and has traditions, and it's hard to think about what this year might look like in order to follow the guidelines, but still try to maintain some kind of tradition. And as everyone knows by now, Thanksgiving did not turn out very well for us, even though we had Canada to follow, because Canada had their Thanksgiving in October, and we saw that, they had a spike, and now we are definitely experiencing a spike. We've had the Central Valley's ICU capacity go down to 0 over the weekend. And we are, getting very close to having very limited ICU capacity down here, up north, all around California. So these are all being borrowed from a group of volunteers out of Boston University who have decided to try to break down a lot of the COVID-19 information into something that most people can use and understand. So a lot of these are basics that you may have heard already. The guidelines that are developed by each county and by the public health officers are really based on the community spread of COVID-19. So the difference between around the summertime and now is because the community spread has gone up so high compared to where we were back in the summer. And the difference between outdoor and indoor is also significant. So the chance that you'll be able to transmit or catch COVID-19 is much greater indoors than outdoors. Also, the duration of gathering, so how long you are near somebody who may have COVID-19 is also a factor in whether or not your risk in getting it. So all of these different factors, the location, how long you spend there, the number of people there, where people are coming from, because there's different rates of spread across the country or across the world, and what people are doing. So maybe you are, quarantining and following all the rules, and maybe some of the guests who are at the event, maybe they haven't been as strict in following the guidelines. And are people wearing their masks during the gathering, or are they taking them off? So there's a lot of different factors that impact whether or not your event can be safe. And even to get to the event, this just summarizes the risk of getting there. So whether you choose to take an airplane, a bus, a train, or to drive by yourselves, none of them have a zero risk. So with the plane, they've been doing studies around, whether or not the air circulation is sufficient. The studies seem to indicate it's a relatively low risk as long as you keep your mask on. However, the studies that were done were limited because they only tested it with a dummy spreading the particles without without studying whether or not what happens when a person gets up and down, and walks up and down the aisle, or air movement changes that way. So there are risks that aren't really accounted for in those studies, and there's also the risk of being in the airport itself. That there are long lines, there's security, so there's a lot of times you'll spend in close quarters with other people that are not necessarily on that airplane where there's a lot of air circulation and air being filtered appropriately. Similarly, with the bus or a train, there's a lot of risk when you are, you're all together into a place where there's no air circulating. So it might be too cold to keep the windows down. And even if there's air conditioning on the bus, that might actually help to spread germs a little bit more. So without that ventilation, the bus or train can also be risky. So a lot of people are going with the car, just driving in their own car with people they know. However, there's all the rest stops and stopping for gas and other things that also increase your risk of being exposed. So none of these are zero risk, and that's why they're recommending that people stay at home with their household and just sit this one out, and we'll hope for a better holiday in 2021. Even Dr. Fauci and other leaders are, not able to see their families either. So it's a shared pain across many of us. So there's a lot of creative ideas that people are thinking of. So maybe exchanging gifts outdoors. We are fortunate here in California where we can go outdoors. We're not snowed in. We don't have those other obstacles to trying to get outdoors. Having car parades, trying to cook the same meal. Meeting across video so you can all try to cook the same dishes and see who does it best, or watch videos, have a movie night if there's a movie that you all like to watch, whether it's Elf or I don't know what everyone considers a Christmas movie, Home Alone, whatever the classics are that you think are the best holiday movies, watch them together, stream them at the same time, or however you can access it, or open gifts together, or just have a chat, even if it's not by video, so you can stay in your pajamas all day. But basically, the same recommendations hold. So wearing a mask, keep washing your hands frequently, keeping a distance, so 6 feet or more apart, avoiding crowds, close contact, closed spaces, just the general rules that that everyone has been saying over and over. Just we really need to hang in there, even though the vaccines are here. They really only help you if you're not already, if you haven't gotten the virus. So if you're exposed at this point, it's not going to help you. It's not a treatment. It's meant for prevention. So with that, we wanted to share some resources and open it up for questions. So just a list of resources before we get to the questions. There is a community health and resource fair that some of you may be familiar with. It's been in Southeast San Diego for the last few years, providing free blood pressure checks, free glucose checks, free flu vaccines, breast health screenings, and free vegetables and other foods available to you. So they're adding free COVID-19 information and resources so that there's a place to go. They're potentially going to add screening, but for now there's information that you can get from trusted individuals about what do I need to know about the vaccine, or what do I need, where can I get tested, anything you want to ask, and at the same time get those health checkups that a lot of people have been missing up until this point. So if you want to know more about it, you can email info@ahealthierme.com. There should be flyers coming out fairly soon in the next few weeks as they create maps to identify the exact location that everyone should be going. But just wanted to let people know to keep an eye out for that. Fresh start for the new year. And we also wanted to make sure everyone's aware of the Southern California Pacific Islander COVID-19 response team. Keni and Tana are both part of it. And it's a collective effort across several different organizations, and the website is here. They also have been offering similar conversations with the community, just like this one. So if you have additional questions in the future, there are many different opportunities to tune in and get your questions answered. Koviki Talk is one of the probably the more regular ones every Monday. And that is also led by the National Pacific Islander COVID-19 response team, which the Southern California response team is a part of. And that is where the Data Policy Lab came out of. And there's a household survey that is going to be coming around. And Keni and Tana can probably speak more to that as well as we head into the Q&A. I think we have some Q&A in the box.
This is Dominic. Yes, and thank you, Keni, for already starting to answer them. For those of you who are unable to see from Facebook Live, one of the questions posed was, can you share again how to enroll in the study for the COVID vaccine trials? Keni answered, you can enroll through Coronavirus Prevention Network, all one word, .org. If you are eligible, a clinical research coordinator will reach out to you. Also, another question is, can this vaccine interfere with other medicine or impact viruses like HIV or hepatitis, etc.? And Keni answered, the vaccine does not interfere with any medications. You will have to talk with your healthcare provider to discuss your specific health conditions and whether or not the vaccine will be safe for you. Sorry, my video was off that time. And looking on the Facebook, I don't think there are any extra questions there, but other community health workers, feel free to chime in if you see something.
Hi, everybody. This is Tana Lepule. It's definitely an honor to be amongst this panel. I try to find out as many things as I could because you can't always trust everything that you see on the internet. So I surround myself with some smart folks, and Keni and Mona are definitely some of those folks. Myself, I'm a Pacific Islander advocate. Also had a span in the overall Asian and Pacific Islander communities. Actually, my starting grounds was right there at Union of Pan Asian Communities. And it's still good to see that UPAC is still leading the way with advocacy and grants, information and education for our Asian American Native Hawaiian Pacific Islander community. So kudos to Margaret, Dominic, and the team out there at UPAC. My role here pretty much is just from a community advocate's position with regards to the vaccine, the various vaccines, and kind of like the myths of, kind of what the dialogue has been in our Pacific Islander communities. And it was alluded to earlier by our speakers that, clinical trials are very important because that kind of leads to, a solution or some vaccines that would actually help to kind of address whatever the pandemic may be. And we've had, successes with like the flu and other illnesses. So it's important. And I think Keni had mentioned earlier that it's also very crucial for specific ethnic communities to participate in it. And this is not a recruiting session here, but it's more an information and, to give ourselves as much knowledge that we can make our own sound decisions to participate or not. And if you can see from the previous poll, everything was either yes, definitely, or possibly. So for me as an advocate, it's good to see that kind of thinking is there within the communities. I also just wanted to, elaborate a little bit more with ethnic specific resources. Mona had mentioned at the end there with Southern California, and then also our national. There you could actually find in-language materials too that were developed by some of these task force, and then some even at the federal level, but a lot of time access to ethnic specific or language specific resources are very limited or not known. So those are two wonderful resources that you can go to. And you can see, Mona also mentioned with our other ethnic communities, there's a lot of things that we could share and learn from each other. So it's important again to not only see what's going on in your community, see what's happening in other communities, but also just, for myself, data disaggregation is very important. And I think we're very fortunate here in San Diego County that the county actually breaks out Native Hawaiian Pacific Islander data. What I didn't see though is the Asian communities not being really broken out. And then with data like a third of the US, a third in the US died for Filipino nurses, but they only make up 4% of the nursing population. To me, I see that's a piece that you can kind of leverage your local health departments to, I think, yeah, your local health departments to, kind of advocate for disaggregated data to pull those out. And I think for all the Filipino Nurses Association, which I've been involved with sometimes in the past, I mean, those are definitely leveraging points to make arguments for, having that population being one of the first to be tested as essential workers. So I just wanted to highlight those different things. We also had the data policy lab, very crucial because, we know all the anecdotal stories, but in the real world and in the world of research, data is kind of where it's at. And we were very fortunate to get the data policy lab, and those are actually run by 3 Pacific Islander, very talented young folks. That's it.
Thank you so much, Tana, and Keni and Mona as well. The three of you are amazing and are bringing so many resources to this conversation. I really appreciate all three of you. And it doesn't look like we have any new questions posted on Facebook or the Zoom, but I want to encourage all viewers, feel free to go ahead and ask any questions. I think it was also a Filipino nurse who provided the first vaccine to a healthcare worker, and so that's something for our communities to be proud of as well. It's unfortunately we're involved on many sides of this pandemic, right? And
I want to add that I think it's great that most people responded that they are willing to get the vaccine, because I think one of the things that is misunderstood about herd immunity is that even though, yes, they're aiming for somewhere around 70 to 80% of the overall population to be immunized, there's a difference between the overall population getting the vaccine and whether your local community gets it. So even if we achieve it across the country in terms of herd immunity, if your local community doesn't reach that level, then you may still be at risk. So it's important to have that conversation with your local groups, who you interact with, where your kids go to school, where you spend time, just to understand whether or not you will continue to be protected even if you get the vaccine, because you want to make sure that where you and your family spend the most time will continue to be protected as best you can. And another question I heard earlier today was the difference between natural and acquired immunity. So whether it's better to just get COVID-19 and get immunity that way, or to get the vaccine. And Dr. Corbett herself, who was the one who led the development of the Moderna vaccine, mentioned that when they did the studies on antibodies, those who got the COVID-19 infection naturally, who were infected, maybe a third of them, somewhere between a third and a fourth of them, were not able to produce antibodies. So they didn't have a strong immune response, compared to those who got the vaccine. 100% of them had a strong immune response and they had antibodies. So in terms of comparing risks and benefits of getting the vaccine versus going through the infection and trying to acquire antibodies that way. It seems to be, there seems to be more benefit to the vaccine helping you to produce the antibodies to then fight off any potential COVID-19 infection. But I will defer to Keni on any additional questions since he has the clinical and the research background. Oh, I see we have a question. Any advice for talking to family members who are tired of masks and distancing? I feel I'm nagging and it's impacting my relationship with family members.
I was gonna read it, but go ahead.
Yeah. Oh, sorry.
No, please take it.
Okay. That's a tough one. I agree. It's tiring. This is not what we're used to. But it can help to just try to take a fresh perspective of looking at it. So depending on which family members are tired and whether or not you're close to them or not, just reframing how you're approaching the mask. So similar to the vaccine, it's protecting yourself, but also protecting others, protecting those who are the most vulnerable. So I don't know if anyone in your family is ill. So there's a lot of people right now who are going through treatments that they don't have the immune system to protect themselves if they were to get sick. And I think that makes it that much more important for us to keep wearing masks, even if we're tired. And it is frustrating, and I completely sympathize. I have not seen my family since 2019, and I did not anticipate that. I've missed a lot of things, a lot of family events, and that's very frustrating. But at the same time, there are some family members who are at such great risk that trying to see them would be devastating if anything happened. And I think back to the story of there was a wedding in Maine, and this has happened in multiple places since then, but this was most striking because I think this happened in August. And they did not wear masks, and it was on the smaller side for a wedding, and about half the guests got infected. I think it was 27 people got infected, and eventually it spread so far. It reached a couple in their 80s or 90s who lived hundreds of miles away, who hadn't seen people. They had been keeping to themselves because they were afraid of getting sick, and the wife got sick. Somehow it went from the wedding guest, who then spread it to, I think, her mom, who spread it to another child who worked at a healthcare place, and spread it to other healthcare workers. And it eventually reached this old couple who thought they were doing all the right things, and the wife ended up passing away. They both got sick, but the wife passed away. And a total of 7 deaths and 3 hospitalizations have been attributed to this wedding alone, that they know of, based on contact tracing. So I think that keeping that perspective can be helpful, because you don't know who you're protecting, because it can be hard to see who you might infect, because it's so insidious that sometimes if you don't know that you're sick and maybe you don't have any symptoms, you could unknowingly spread it to someone else, who then unknowingly spreads it to someone else who's extremely vulnerable. So I agree, it's hard. A lot of us don't like it, but it's just something we got to do until we can get the vaccine widely available. Tana, I don't know if you have any suggestions. I know you've had this hard conversation many, many times.
Yeah, so I can definitely relate to this. I mean, to be honest, folks, I hate the hell out of masks, but I also want to live, and I also don't want to endanger folks who I love. And I don't want to endanger anybody, really. I don't want to be responsible or have that, over me. So I'm going to do it. I mean, I think wearing a mask to live longer, I'll get used to it. And I would encourage folks to try and do that too. With regards to talking to family members, it's been hard. I've had some funerals where I knew I purposely didn't go because I knew there was not going to be any social distancing. And you can imagine cultural groups who are very, hugging and kind of close contacts. Culturally, that's it's part of the culture. So it's hard to kind of, when grandma or aunties like reaches out to give you a hug, it's going to be hard to do that. But, for myself, my decision was not to go to some of these events, which I took a hit on, but some folks also got it. But I think what's important is to have the serious conversation, and it could be either serious, it could be in humor. My family knows me as a humorous guy, so I make light of it, and I'll say, I'll send you a UPS hug, and I'll just do air hugs. And so that's slowly catching on. I would say diversify, try different ways. Also, maybe for those folks who don't want to take some of those advice, see who are influencers to them, whether it's elders or doctors, or influencers. Find those different resources. The Pacific Islander ones, we had Goviki Talk, which is a discussion around COVID-19, and we've had a panel of Pacific Islander doctors. We had a panel of faith-based leaders. We had a panel even like ministers' wives. So it's a matter of finding it, and I think this person said nagging. I think if nagging is going to lead to saving lives, keep nagging. But if you feel guilty about that, maybe switch it up and put it in a humor kind of approach. But folks should not be mad that you're trying to save your life, but also their lives. So stay the course.
Yes to all of that. It's you can get more flies with honey, is that the saying? It goes a long way to take a positive turn on it. Everything we're doing is out of love and caring for each other and wanting the well-being and safety of others and ourselves, right? Thank you. There's another question in the Q&A on Zoom, and it has to do with the new app or setting in smartphones that Google and Apple teamed up to create. It just came out a few days ago. Is the contact tracing app throughout the US or just California? And I added the link to the California website talking about this exposure notifications app, canotify.ca.gov. And Tracy is saying contact tracing is not national, and it is up to each state and individual to decide which tools best fit their needs. Thank you, Tracy. We also included an FAQ, frequently asked questions document from apple.com on the exposure notifications. It's a voluntary thing, and it's meant to be in addition to in-person contact tracing or, with someone who calls you. It's not meant to replace that. It also doesn't keep your personal information. It encrypts it, and it doesn't track your location either. So just to answer some of the common questions about that, you can turn it on. You can choose to turn it on in your phone if you have an iPhone or Android, for example, but you don't have to. And Tracy or anyone, if you wanted to add on to that.
Yes, also you can go to CDC website and they have all the questions that kind of similar to what our attendees are asking today. They do have it available on CDC website. And you can find most answers on there.
Hi, if I could just kind of comment again on something that was mentioned earlier with Keni's presentation with regards to the Operation Warp Speed does not equal skip steps. I think just the concept of clinical trials itself could be kind of a nowhere land. But as a person who's learned and advocated and have been more informed now with, again, like surrounding myself with key folks, I now know that clinical trials, you're not left alone. You're actually safety is monitored throughout the whole process, like Keni mentioned. So, for those who may think that you're like a guinea pig, it says you are because you're helping to kind of test things out, but at the same time, it's not you're not left alone. You're being monitored throughout the whole process, and I just wanted to put that out there for folks.
Thank you, Tana. Yeah, it's so easy to think of being a guinea pig when the purpose of your participation in it is to get data that we didn't previously have, right? But to echo what the presenters were saying too, it's important for different types of people to participate in these studies if you can, to see the broadest possible range of effects it can have on all different types of people. But the safety and well-being of the participants is top priority, like Donna said. There have also been a lot of recent updates from the governor of California and San Diego just in the last few days. We can share, you can get those updates from the coronavirus-sd.com website, because there have been a few changes. The governor has signed an executive order concerning migrant laborers, for example. And so we just encourage everyone to take a look at that website to see all the updated slides and notifications. And we're almost about at time. Tana, did you want to say anything to close us out, or any of the other panelists?
Yeah, just, I know we shared some of the Pacific Islander resources, but also if there are other ethnic community members out there on the call or the town hall, I would say Google your community and then see what COVID-19 task force there are, because you'd be surprised that, there probably is an existing one. My wife is Filipina, and so, I've been nosy and I found out that there's a San Diego Pacific Filipino COVID response team. So I joined their group to kind of see what's going on in that communities. That was where I found out that they didn't disaggregate Filipino, data, and I advocated with them to kind of push the San Diego County to either give access to that or to actually disaggregate that. But I would encourage folks to look that up. You can contact me through Dominic. We can help find some of those resources for you if you want to look specifically for your ethnic communities. Thank you.
Yes, thank you. And UPAC, Union of Pan-Asian Communities, also has a lot of language translation resources. So thank you very much. All right. Well, again, I really appreciate everyone who helped put on this event tonight. Have a wonderful night. I'll stay on to just wind down the closed captioning, and feel free to contact us through our website as well, upacsd.com. Oh gosh, I'm getting com and org mixed up. .com/programs/CHWCOS for more information. Thank you and good night. Thank you, presenters. Hope to see you.
Thank you. Thank you, UPAC team.
Stay safe, everyone.
Thank you.
Thank you.
And Happy New Year, huh?
Dominic, we have two more questions. Do you want to address that?
Oh, yes. Here on Zoom, it says one of them is, if a family member is elder and at risk and gets the vaccine, but I am not eligible till much later. Oh, because they're in the higher risk category due to their age, I'm assuming. Would it be okay to go out and not worry so much? Oh, that's a good question. Jeanette, Tracy, Dr. Mona, if you want to answer that.
You know, even though the vaccines are available now, we're still, and you know, they were done at record speed, but safely. There's still a lot of information that we are still not fully aware of. So it's recommended that everyone continue to follow the guidelines, wearing masks, keeping a distance until everyone has gotten the vaccine and has reached, we hopefully will reach herd immunity. They expect that to happen sometime in the middle of next year, 2021, if everything goes according to plan. But it's still too big of a risk because you don't know for sure if the vaccine will, even though we anticipate the vaccine will be effective, you just don't want to take that risk right now. Just, you know, everyone just needs to hold on a little bit longer, and we will get a better sense of what things look like towards early 2021. And I see there's another related question. Not saying it's better that I get COVID, but it's better than if my elder member does. And if this person has the vaccine, won't it be okay? It's, yeah, this is again, it's too great of a risk. We just we all just need to keep following the masks, the social distancing guideline, and keeping each other safe until everyone has the vaccine and the vaccines have had a time to take hold and provide that level of immunity that's necessary to protect everyone. And we'll see how long the protection lasts. So, so yeah, we just got to keep doing it for a little bit longer, and hopefully we will have a much better 2022.
Thank you so much. Yes, that's a very thorough answer. We want to layer those cheese slices, right? Of preventive
Exactly. You've seen
measures.
that picture. Yes,
Yeah,
exactly.
nothing will be perfect, but the more prevention we can add, the better.
Exactly. Yeah.
Mhm.
Don't take that risk. You know, we all want to get back to a much better year than this year was.
Right. Thank you. I
Thank you.
really appreciate you so much.
Oh, appreciate you having this forum. So
Yes.
thanks.
Okay. Well, we'll be in touch. Have a great night,
All right.
everyone. Thank you. Bye-bye.